The pain started as a dull ache in my abdomen in early April. By mid-April it was sharp and constant. By the third week I was in the emergency room at 2 in the morning, vomiting from the intensity. "You have a ruptured appendix with peritonitis," Dr. James Holland said, reviewing my CT scans. "This is a surgical emergency. We need to operate within hours or you're at serious risk of septic shock and death." I was 27 trying to process the word, death, coming from a surgeon's mouth. How long ago did it rupture? Based on scans and symptoms, 36 to 48 hours ago. The infection has spread throughout your abdominal cavity. This is life-threatening. I called my mother. She answered, voice groggy and annoyed. "Jessica? Do you know what time it is?" "Mom, I'm at St. Catherine's Hospital. Ruptured appendix with peritonitis. Emergency surgery in a few hours. I need you here." Long pause. "A ruptured appendix? That seems dramatic. Are you sure they have the diagnosis right?" "Mom, I've had CT scans. The surgeon showed me the images. My appendix ruptured and I have severe infection. This is serious. How did you let it get that bad? You must have ignored symptoms for days. This is exactly like you. You never take care of yourself, then create medical emergencies that could have been prevented. Can you just come to the hospital? Jessica, your father and I are leaving for our Caribbean cruise tomorrow morning. We've had this planned for 6 months. We can't just cancel because you need a minor procedure." "Minor procedure? My appendix ruptured. The surgeon said I could die from septic shock." Surgeons always say worst-case scenarios. It's how they justify their fees. You're in a hospital getting treatment. You don't actually need us there. You're an adult. Have the surgery, recover, and we'll see you when we get back in 2 weeks. My father's voice in the background. "Tell her we'll bring her back a souvenir." They hung up. I called my younger brother Tyler, finishing his senior year at State University, graduating in 3 weeks. The golden child. "Jess? What's up?" "Tyler, I'm in the hospital. Emergency surgery. Ruptured appendix. Can you come?" "Oh man, that sucks. When's the surgery?" "In a few hours. They said it's life-threatening." Yikes. I've got my final capstone presentation at 9 this morning. Worth 40% of my grade. I can't miss it or I won't graduate." "Tyler, I could die." "I mean, you're not going to die. You're in a hospital. But if I miss this presentation, I don't graduate and Mom and Dad will kill me. Plus graduation is in 3 weeks. You're still coming to that, right?" "I'm having emergency surgery right now." "Right, but that's 3 weeks away. You'll be totally recovered by then. Appendix surgery is like outpatient stuff. Just rest up and make sure you're good for graduation. Mom's planning this huge party." He hung up to get ready for his presentation. I lay there alone and cried. Not from physical pain, but from realizing a Caribbean cruise and graduation party were more important to my family than whether I survived. My best friend Monica arrived 30 minutes later, still in pajamas. She was a charge nurse at another hospital. "I'm here. I'm not going anywhere." The surgery took 4 hours. Dr. Holland had to perform an open appendectomy, not the minimally invasive procedure, because the infection was so severe. They removed my ruptured appendix, cleaned infected tissue and placed surgical drains. I woke up with Monica holding my hand and Dr. Holland beside my bed. "Jessica, you're stable, but that was touch and go. The infection was more extensive than we thought. You'll be hospitalized at least a week on 4 antibiotics. This was very serious. If you'd waited 12 more hours, we'd be having a very different conversation, if at all." My family didn't come. Parents are on a cruise. Brother had a presentation. Dr. Holland's jaw tightened. "I'm sorry. What my family didn't know was what I did for a living. I was Director of Human Resources and Employee Relations for Metropolitan Hospital Network, the largest hospital system in our state. 12 hospitals, 40 clinics, 23,000 employees. Every employment contract, every hiring decision, every termination, every staff complaint came through my office. My mother worked as a medical records clerk at St. Catherine's Hospital, this very hospital. 8 years there. My father worked in facilities management at Mercy General, another network hospital. 10 years there. Both were employees in the hospital system I oversaw. I spent 7 days in the hospital. The infection was stubborn, requiring multiple antibiotic rounds. The drain stayed in 5 days. I ran fevers spiking to 103 degrees. Dr. Holland visited twice daily, clearly concerned about my recovery and lack of family support. Monica came every day after her shifts. My HR colleagues sent flowers and care packages. The network CEO Margaret Chin called personally to check on me. My parents sent one text from their cruise. Hope you're feeling better. The beaches here are beautiful. Beach with umbrella. Tyler sent a photo celebrating after his presentation. Nailed it. Graduation, here I come. Graduation cap. I was discharged on day 8 with a PICC line for home 4 antibiotics, strict wound care instructions, and orders not to return to work for 3 more weeks. Monica stayed the first 2 nights to help with medications and basic tasks. My parents returned on day 15. They didn't visit. They called once. We're back. It was amazing. We brought you a shell necklace. We'll drop it off sometime. How are you feeling? I almost died, Mom. I was in the hospital 8 days with severe infection. Well, you're out now, so clearly you're fine. You always exaggerate how sick you are. Remember the flu in high school? This is the same. You had minor surgery and you're making it into a dramatic production. Minor surgery? They cut me open and removed infected tissue from my entire abdominal cavity. Surgery is surgery. Plenty of people have appendix surgery and go back to work in days. You're milking this for attention because you were upset we went on our cruise. We're not going to feel guilty about a vacation we'd planned for months just because you have bad timing with health issues. Bad timing. Yes. If you'd gone to the doctor earlier like a responsible adult, this could have been a simple laparoscopic outpatient procedure. But you waited until it became an emergency, then expected us to cancel our expensive cruise. That's not fair. I see. Anyway, we need to focus on Tyler's graduation. 10 days away, huge party planned. You're still coming, right? We told everyone you'd be there. Tyler's your only brother. This is a big milestone. I'll think about it. Don't be like that. This isn't about you. This is Tyler's day. You need to be there. We're your family. I hung up and thought about that word, family. 2 days later, back at work part-time from home, I reviewed routine employee files. 2 names appeared. Patricia Morrison, medical records clerk at St. Catharines. David Morrison, facilities manager at Mercy General. My parents. Every employee underwent annual performance reviews and contract renewals. As HR director, I didn't personally conduct every review, but I reviewed all documentation and had authority to flag any employee for additional scrutiny. My parents' files showed adequate performance. Nothing exceptional, no major issues. Standard raises each year, no formal complaints. But the employment handbook every employee signed included a code of conduct clause. Employees were expected to maintain personal behavior consistent with the compassionate, patient-centered values of the organization, both professionally and personally. I called our chief legal counsel, Robert Brennan. Robert, I need to discuss a code of conduct question regarding my parents. I want to handle this correctly and ethically. Go ahead. Both my parents work for the network. 3 weeks ago, I had emergency surgery for ruptured appendix with peritonitis at St. Catharines. My parents refused to come because they had a cruise scheduled. They called my life-threatening surgery a minor procedure that could wait and blamed me for bad timing. Robert was quiet. Your parents are medical support staff, and they dismissed a ruptured appendix as minor? Yes. They said I was being dramatic. They went on their cruise and didn't visit once during my 8-day hospitalization or after discharge. Jesus, Jessica. I'm sorry. Does their behavior constitute a code of conduct violation regarding compassionate, patient-centered values? That's complicated because it involves your personal relationship. Let me reframe. If any employee, particularly in patient care support, publicly demonstrated this level of callousness toward a family member's life-threatening medical emergency, and that became known within the hospital community, would it raise questions about whether they embody our values? When you put it that way, yes. Hospital culture is built on empathy and compassion. If staff demonstrate fundamental lack of those qualities personally, especially regarding medical emergencies, it raises valid concerns about organizational fit. So I could flag their files for review? You could. But you must recuse yourself from final decisions. You can flag the concern and provide information, but another HR director makes the final call. Understood. I flagged both files with detailed documentation. Text messages dismissing my surgery as minor and optional. Phone records showing 1 call in 8 days. Witness statements from Monica and Dr. Holland about my condition and prognosis. Summary of their continued dismissal of my medical emergency. I attached a memo. Employee behavior raises concerns regarding alignment with organizational values of compassion and patient-centered care. Recommend review by senior HR leadership. I forwarded both files to Senior Vice President Dorothy Palmer, 30 years with the network, fair but uncompromising about standards. Dorothy called 2 hours later. Jessica, I've reviewed the files. I'm not making this decision because you're involved. I'm making it because this behavior is genuinely incompatible with our mission. I understand. A ruptured appendix is a medical emergency. Peritonitis is life-threatening. Anyone working in a hospital should understand that. Your parents dismissing it as minor and optional demonstrates either profound medical ignorance or willful disregard for suffering. Either way, these aren't people I want representing our hospital system. What are you recommending? Contract non-renewal for both, effective at current contract period end. 60 days to find other employment. They're ineligible for rehire in any network capacity. Not termination for cause, so full benefits through contract end, but we're not keeping them. Dorothy, I need you to be sure. These are my parents. I don't want anyone thinking I'm being vindictive. Jessica, if these were any 2 employees who behaved this way toward a family member's life-threatening emergency, I'd make the same decision. Hospitals need employees who understand compassion, who value human life, who recognize medical emergencies. Your parents failed that basic test. The non-renewal notices were issued Friday, May 12th, 10 days before Tyler's graduation. My phone exploded. 34 missed calls from my mother. 18 from my father. 47 texts from confused to furious. My mother's voicemail. Jessica Lynn Morrison, what the hell did you do? We both got non-renewal notices. They're letting us go. After 8 years, after 10 years. And we know it was you. How could you destroy your own parents' careers because you're petty and vindictive? We're losing our health insurance, our income, everything. Right before Tyler's graduation. You've ruined everything. My father's message, you're dead to us. You're not our daughter anymore. Don't come to graduation. Don't ever contact this family again. Tyler texted, seriously? You got mom and dad fired right before my graduation? What the fuck is wrong with you? I didn't respond. Dorothy called next morning. Your parents filed a complaint alleging you abused your position for personal retaliation. What happens now? Standard investigation. Robert Brennan is handling it personally. The investigation took 3 days. Robert interviewed Dorothy, reviewed all documentation, spoke with Dr. Holland about my medical condition, interviewed Monica, and pulled security footage showing my parents never visited during my 8-day stay despite working in the same network. He called Tuesday. The investigation is complete. The non-renewal decision stands. Your parents' complaint is dismissed. On what grounds? Their behavior genuinely demonstrated lack of basic compassion and medical understanding incompatible with hospital employment. The decision would have been the same regardless of your involvement. Several people we interviewed expressed shock that your parents could work in healthcare and show such callous disregard for a life-threatening emergency. Thank you. One more thing. Your parents have been telling people, including other employees, that you got them fired out of spite. That's creating workplace disruption and damaging your professional reputation. Dorothy issued a cease and desist notification that further defamatory statements will result in forfeiture of remaining benefits and potential legal action. My parents stopped calling. I didn't attend Tyler's graduation ceremony or party. I was still recovering, still on antibiotics, barely able to stand for extended periods. But word got back through Monica. My parents spent the party telling everyone I'd vindicatively destroyed their careers, because they'd taken a vacation. Until a physician who worked at Mercy General asked about the vacation. My mother, emboldened by wine, told the whole story. The midnight call about stomach pain. How they couldn't cancel their expensive cruise for a minor procedure. How I'd been overdramatic about simple appendix surgery. The physician, Dr. Anthony Chin, went still. A ruptured appendix with peritonitis? That's what your daughter had. She made it sound worse. A ruptured appendix with peritonitis is a surgical emergency with significant mortality risk. Did you know she was hospitalized 8 days? Did you know she had severe septic complications? She exaggerates everything. Dr. Chin said loudly enough for everyone to hear. Your daughter almost died from septic shock and you went on a cruise. You work in a hospital and you called a life-threatening surgical emergency minor. Do you understand how profoundly wrong that is? Now you're surprised the hospital system didn't want employees who demonstrate that level of medical ignorance and lack of compassion? You're not victims. You're exactly the kind of people who shouldn't be working in healthcare. He left. So did several other medical professionals. Tyler's celebration dissolved into chaos. Tyler blamed me for ruining his party, even though I wasn't there. I blocked his number after he called me a vindictive bitch. My parents' 60-day contract period ended in July. They left Metropolitan Hospital Network. My mother found medical billing work at a private practice. My father got commercial building maintenance work, not healthcare related. Word spreads in medical communities. Those are the people who went on a cruise while their daughter had emergency surgery, became a story that made rounds. Their reputations were permanently damaged by their own actions. I recovered fully by August. The scars faded. I returned to work full-time. Dorothy called me in one day. Since your parents' non-renewal, we've received 3 reports from their former colleagues who witnessed similar dismissive behavior toward patients and family members. Nothing formal but a pattern of callousness that made people uncomfortable. We made the right decision. Thank you for telling me. You did nothing wrong. You flagged a legitimate concern, recused yourself and let the process work properly. That takes integrity. I ran into Dr. Holland 6 months later. Jessica, you look wonderful. Fully recovered. Fully recovered. Thank you for saving my life. I'm sorry your family wasn't there. I'm not. I learned who my real family is. Monica, my colleagues, people like you who actually cared whether I lived or died. He smiled. For what it's worth, I heard about your parents' employment. The hospital made the right choice. Compassion isn't optional in healthcare. It's fundamental. I'm 28 now, healthy, thriving, completely estranged from my parents and brother. They send nothing. I've heard through distant relatives they blame me for ruining their lives. But I didn't ruin their lives. I survived despite their neglect, and I ensured they couldn't continue working where compassion and patient-centered care were core values. They called my emergency surgery optional. They called my life-threatening condition minor. They chose a Caribbean cruise over their daughter's survival. The hospital chose not to employ people who demonstrate that level of callousness. That wasn't vindictive. That was accountability. My appendix scar has faded. My relationship with my biological family is gone. And I'm okay with both. Because some procedures aren't optional. Some infections spread. Some families are toxic. And some decisions, no matter how difficult, are absolutely right.